Good day everyone, I am Rika Hadormio, a 24 years old, and I have this small chin that makes my double chin so obvious. Bale, pag ngumingiti ako and naka-side view, halatang halata yung double chin ko, and that makes me very insecure to my face. So it would be my first time to do this non-surgical procedure, and I am very grateful that our beautiful Dr. Contessa Salvador will be the one who gonna help me with my concern. And also, don't forget to like, share, and subscribe, and never miss a new video.
Good day everyone! Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we'll be doing a balancing of the face, particularly on the lower third. We'll be improving the so-called 1/3, 2/3 rule on the chin region. But before that, let's all welcome Miss Rika.
Hi Doc! Hello everyone!
Yeah, how young are you, Rika?
I'm 24 years old, Doc.
She's so young and she's so beautiful with a small face, petite face, right? And I was assessing Rika a while ago. I was checking on the lower third of the face and I noticed that there is this like short chin, right?
Yes.
And in terms of the vertical projection, okay, or the anterior projection, so far so good with the anterior projection, but we lacked in terms of the vertical dimension there, okay? So anteriorly, if you check on the Ricketts E line, it's good. But when it comes to the rule of 1/3, 2/3 here, we need to improve this length or the vertical dimension. And if you have a short chin, okay, what we also notice is you have a prominent submental bulge there, or you call it
Double chin.
There you go. So when she's like on her side view, we notice the bulging of the under the chin, or they call it double chin, okay? Now, this is something that Rika inherited, okay? It's genetics. So, it's not from aging. You're just 24, okay? And I was also checking on the mandibular bone. I noticed a so-called hypoplasia there. So, the bone is really, really short and narrow. Okay, for a narrow face, okay? But we wanted to also improve the so-called proportions. We wanted to make everything harmonious and balanced. So we want to have that good contour and also get rid of...
My double chin.
Are you conscious about this?
Yes, Doc.
Yeah, because we have patients coming in, males, females, wanting to improve this lower part of the face because they're so conscious about the under chin area, or they call it double chin, okay? They want to get rid of that. They want also non-surgical, no cuts, okay? They want to have this minimally invasive procedure with as much as possible minimal to no downtime, and a natural, young-looking face, okay? Because it also is part already of our rejuvenation treatment. Okay, what kind of treatment, what procedure, we'll show you when CSA Medical Aesthetics return. and we're back. So we will be doing a correction of the length of the chin of Rika, okay? So we've mentioned a while ago that it's more of the vertical dimension that is inadequate, okay? So with the rickets E-line, when we check it, it's within the rickets line. However, the rule of 1/3, 2/3, so that one is we have this lack of this length here. So we wanted to elongate, we wanted to lengthen, okay? And I also noticed with Rika, I told her about her cleft chin, and I asked her if she's okay with her cleft chin, if she wants to treat it or leave it like this, and she told me, I leave it up to you, doc. Okay, there you go. But I was sharing with him, like over time, some individuals, when they have this will further deepen or sunken, creating that kind of scar in the center of this chin apex, okay? So we can somehow feminize, still make it more feminine chin, okay, Rika? So we want the chin to be rounded and of course to have that good projection and not the male type of chin that's square and wide. So we want her a narrower chin, rounded, and the correct length. So proper elongation. Now the non-surgical method will be the injection of our hyaluronic fillers or dermal fillers, okay? So for our markings, okay, as a review again, we've done this in the past. So for Rika, I'm also checking at the sulcus here below the lower lip, okay? So a little bit of improvement of this sulcus, minimal only, and she wanted me to improve already this apex, okay? So we wanted to feminize the chin, make it pointed here, and then also we want to elongate, so we'll work again on this lower mandibular border here, and we can extend this up to the pre-jowl sulcus there, okay? And we can extend this to this part of the pre-jowl sulcus here. So we want to elongate to also get rid of our double chin. And then on the opposite side, same thing, we will make this rectangle here for the inferior mandibular border there and extending to the pre-jowl sulcus here. So for women, okay, we want the product material to be beneath the mandible bone, not in front of the mandible bone, but beneath that to elongate it, okay? So again, we'll improve a little bit the sulcus here, and we want to feminize the chin apex, okay? Another thing that I've noticed with Rika, she has hypoplastic mandibular bone. So I was palpating for the angle of the mandible. I wanna improve this region here. Just inject my dermal filler at the posterior aspect. For women, we place it at the posterior aspect of the angle of the mandible. So that area there will be the one for female type of jawline, okay? So, because we don't want the widening of the so-called bigonial width. We want a face narrower. We just wanted to give that good jawline or a so-called well-defined jawline for women, okay? So it's a different treatment for men, a different treatment for women. We wanted to make the treatment appropriate for our female client. Okay, so that's the landmark. Now, what do we avoid here? Again, for our doctors, we are anatomists. We want to avoid the antegonial notch where you have your facial artery. So I need a red marking for my facial artery, okay? So for our doctors, you mark your facial artery here from your antegonial notch. It's anterior to the masseteric muscle there. Same thing on the opposite side, okay? So this now will be our landmarkings, a review of our anatomy. So this is facial artery coming out from the antegonial notch. Okay, so as with any other procedure, we have to make sure that everything is clean, sterile, okay? So you disinfect everything, and prior to your treatment, you can apply also your numbing cream, your lidocaine cream, and also leave that cream for about half an hour. Okay, so I'll be using my hyaluronic dermal filler. Okay, so you need a Hygie Prime, a firm gel for your chin elongation. Okay, I'll start working on the suckle dip sulcus there. For my entry point, I'll be working on this aspect here. Now I'm avoiding the mentalis foramen there. And if I have a length of like a 40-50 millimeters, sometimes I do a measurement there, I'll make an entry point here. So disinfect please. So what I do is I pinch this area here, so less of any discomfort on her. So ideally, if we have a gauge 22 needle, your poker should be like a gauge 19 or a gauge 18. And this is a tiny prick. Also, make sure you have a correct opening there, and direct your cannula perpendicularly, and we're gonna be placing the product in the dip sulcus. My goal is to somehow soften that dip sulcus there, and I'll glide in the subcutaneous plane. Okay, while gliding it already, I can push a little bit of my product material. Okay, so it's normal for some resistance there while you are pushing your cannula with your product. And take note, so the mentalis foramen is on the bone. So mentalis vessels on the bone, and I am in a subcutaneous plane. So I already am reaching this part here. So a little bit on the dip sulcus there. So glide your cannula, and while gliding, you can already push a little bit of the product there. So I'll be placing a minimal amount here, for example, a 0.25 ml of my Hygie Prime hyaluronic substance there. And you can look at the line on your syringe. While you're pushing, you are also checking on the amount you are already placing. So this is 0.25. So in your dip sulcus, a total of 0.5 can be used for correction of that labiomental region. Okay, so I'm already checking. Now I can direct now my cannula into the chin apex there. So glide again towards this chin apex. Once you reach your chin apex, you can do a bolus push of your material. So expect some resistance here because we have the skin subcutaneous. On top of that, we have also the muscles. Okay, direct it into that chin apex, and you can give a so-called bolus push of your product material. Okay, so you're still good, Miss Rika. So the good thing with the product material, it has lidocaine with it. It helps in numbing, further numbing of the tissues. So there you go, the comfort of your client is also taken into consideration. We want the procedure as much as possible pain-free, and we want the treatment really comfortable to our patients. Okay, so I've inserted a 0.5 of that, and I'll reserve the other 0.5 on the left. Now I'll work on the inferior border of this mandible bone here. Again, for women, we want the product inferior to the bone, not anterior to it. So I'll make another entry point, and I need to clean the area again. So beware of the submental vessel here. Okay, extend up to here because we have a long, this is I think a 50 millimeter. Okay, we can pinch the skin there, make an entry point. There you go. I'm in the inferior border, and I will direct my cannula perpendicularly and go into this inferior side or aspect of the mandible. Okay, so initially there's gonna be a so-called resistance in this region. Okay, and you can do a pushing already, even when you're gliding this, you can already give a product material a little bit. So this is a so-called linear combination, antegrade or anterograde and retrograde. Okay, So I want to fill in this part here, like the pre-jowl also, a little bit of my product material there. Okay, I want to go into the inferior aspect just to elongate the chin part. Then we want to go to that apex there too, so we can fill in this pillar material on this inferior border of your mandible bone. So goal is elongation, so gliding, pushing, and your pillar material is being placed, and while you're placing it, you can do your molding and massaging. Okay, you're good, Rika. So some discomfort actually with the insertion of the cannula, right? Or it's tolerable? Okay, very tolerable. Okay, we want to improve that apex. Okay, place a product material there. Again, she has a good anterior projection already. We only wanted to elongate the chin part of Miss Rika. So I'm already almost finishing with the product. Since it's a high G prime, it's really a viscous product. So it's robust, it's firm, it's a rigid product. So when you push it in your gauge 22, so you really need to exert effort in that part of this chin area. And we know we have some skin and muscle adhesions there, so you want to create a cushion between the muscle and the skin, so specifically your subcutaneous layer. And this is a cannula method, so sometimes I do combination needle method, case-to-case basis. Okay, so just a little bit more and I'm almost done with the apex there, and we're gonna be retracting our cannula already. Okay, let's proceed with the angle mandible here. So just a push of my half mil. So I'll be using now a needle, and I've mentioned that I'll be directing my needle at the posterior aspect of the mandible bone angle. Okay. So going to those, so I've mentioned that Rika really has a hypoplastic mandible, so pushing my product there slowly and avoiding the facial artery here, so pushing the product material. So it's really high G prime, large particle size, high molecular weight product. So when you push it, it is really that much of an effort in pushing the material. So I'm just gonna be pushing a half syringe, and after doing the right side, we'll be proceeding to the left. So we have done the left side. We'll show the result to Rika when CSA Medical Aesthetics return. And we're back. So we'll show the result to Rika. Hey Rika, so we were correcting the short chin. We wanted to improve that vertical length, the vertical dimension. And we wanted to soften and at the same time feminize her chin, because I noticed that it's kind of a bit squarish and she had this like cleft chin. So right now I'm noticing a smoothness, like it's still for women, it's the feminine type, the rounded shape projection is good, length is good, and looking at the jawline area, it's a lot better. So just a little bit of enhancement on the angle of the mandible. So Rika, how was it?
Very comfortable daw.
Yes.
And
Yeah.
ang ganda po ng result.
Right. And I notice right now, there's a reduction in this bulge, the submental bulge, okay? Because whenever I'm talking to Rika, before doing the treatment, so noticeable double chin, right?
Yes, Doc.
Yeah. And right now we reduce it because we placed product material in this inferior border here. So we didn't want to like do further anterior projection because with our rickets line, it was aligned already. But it's the length, so we wanted to place hyaluronic substance here beneath the mandibular bone here. Okay, so very good, very nice result. And looking at that sulcus there, we have that natural convexity. We just wanted to like soften or smoothen it a bit. Okay, so far no marks of those punctures. No, I don't see any bruising. Smile. Okay, so I'm also noticing improvement of the lower lip area. Okay, a better smile. So still able to move the mouth, right?
Yes.
And still able to talk.
Yes.
Okay, thank you, Rika.
Thank you so much for
Yeah. I hope it helped boosted your confidence.
Yes.
And I know this part is your insecurity, right?
Yes.
You were sharing with me that you kind of have this lackness, or rather, what do you call that? You have this short chin, okay? Inadequate chin. It's not receded, it's just short. Maliit lang. Kasi you have a small face, a petite face, so your chin kind of like, we just wanted it to be in the right proportions, right? And also the face become narrower. It will be narrower when you do your lengthening of your chin. Did you notice that, Rika?
Yes, Doc.
So when you do a treatment on the chin region, when you elongate it, it will also help narrow the shape of your face. For those individuals who have that very rounded or really that wide face, especially for women, if you want to narrow it, you elongate your chin. Especially if you see double chin also or submental bulge. Okay? So narrowing, ano pa, Rika? So within proportions, the right length, the right proportions, rather the right vertical proportions or dimensions there. Okay? Okay, so si Rika, nananahimik. It's kind of like, oh, this is something new. Is it your first time to do treatment like this?
Yes, Doc.
Okay.
Natutuwa po ako sa result po.
Okay, so no questions, Rika?
No more, Doc.
Yeah. So after this, just do ice compress, okay?
Yes,
So actually, we'll check on Rika again. Thank you so much. If you have any questions, you may email us at csaskinclinic@yahoo.com, FB page CSA Medical Aesthetics, Instagram CSA Medical Aesthetics. Rika, do you have any social media accounts? So if they have any questions, they may want to reach you.
Sure, Doc. Just contact our number po, and then they will link below.
Yeah, sa CSA number because she's actually working in our front. So, yeah, contact us at 0933-860-9193 or 091750444268. The address, CSA Medical Aesthetics, Infinity Shop, Pulong Maragul, Angeles City. Okay? So, I've mentioned about our social media account, CSA Medical Aesthetics Facebook, and also our Instagram, CSA Medical Aesthetics. So, if you want to ask Rika about her experience and then what happened after 2 weeks, 4 weeks, or 3 months, you can check our social media account. Okay? Thank you so much. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.